Stock of the day is Telix Pharmaceuticals. It is the biotech company focused on development and commercialisation of diagnostic and therapeutic radiopharmaceuticals. In fact, it's just announced positive data from a therapy candidate for prostate cancer. The therapy is for the treatment of adult patients with PSMA, positive metastatic castrate-resistant prostate cancer. You can tell me what that means
Sounds
later.
a mouthful.
Telix's lead imaging product is Illuccix. It's been approved by the US Food and Drug Administration and here by the TGA. Brokers Wilson's coming out today backing the biotech, saying it's set to rise to $20 a share after the company released its latest trial results. And in fact, Telix shares are up more than 1,300% in the past 5 years on the back of success in commercialising Illuccix. And today, they keep on going, up almost 13%. So, Adam,
Yeah, thank
Telix,
you. Thank you.
is
for
it
coming
too late
me
to get on
first.
board?
Yeah, I thought that would be good.
Thank you.
Thought you'd like that.
So look, Telix is, we've actually got a fair few clients or have invested in Telix to start with, and we're on the sort of around that $12 mark. So like some clients have done very well out of it. I guess this update and the company update, and as you say, Wilson's come out with a $20 price target. We've also got, I think UBS has got a $26 price target on it. So there are some brokers that have some very favourable numbers going forward. Obviously the news that the company said is positive for clinical results, and that will build on a lot of prior data that they have for the ProstACT Select trial, which demonstrates that favourable safety and profile and biodistribution going forward. So I think this is a real positive for the stock. The market is really liking this, even though it has continued to run. I think this one you could certainly put in the bottom drawer and continue. So I'm going to say it's a buy.
Okay. Yeah, of course, Henry, I mean, particularly these biotechs, it is hard to understand at times, isn't it, what they're coming up with. And largely it's hit or miss in the sector too, isn't it?
Yeah, but it is in early stage biotechs when they're doing phase 1, phase 2, phase 3. But Telix is way beyond that. Now, last quarter, a revenue of 175 million. You know, this is a money generating machine. There's two things in life you can be sure of: death and taxes. There's actually four if you include the ASX. One is Pro Medicus will just keep going up, and the other is Telix will keep going up as well.
Well, you can add Nvidia to that as well. Keeps going.
I'm not sure about Nvidia.
Right.
I wouldn't include that in the certainties of life, because I remember Blackberries, I remember Nokia, I remember Kodak. You know, these companies that are all, you know, encompassing behemoths.
Yeah.
Eventually, somebody's going to catch up, and someone's going to offer something else, or something's going to trip them up. So, you know, Telix and I think Pro Medicus, yes, maybe Nvidia, not forever. But anyway, this company is class. It's got the Illuccix prostate drug, and it is doing well. It's filing new drugs with the FDA, new imaging. It is producing real money, lots of updates coming through. You know, it's just been on an absolute roll, and I've got to say, I suspect this roll is going to continue. In the land of the blind, the one-eyed man is king. Yes. And when you've got a lackluster market at the moment where there's not really a lot of direction, the market's going to grasp any kind of good story. This is a good story. It's not a biotech which is a binary outcome. If the drug wins or loses or fails or succeeds, this has got a drug, this has got revenue, this is improving the pipeline as well. I like this one. I think $20 is very doable. It's only a couple of bucks away. It's a good 2 days in it.
And there you go. We have begun with a double buy. And Henry, that's one for the investment committee to consider next time.